Hey guys, it's Dr. G. We're going to be in the emergency room this week, so come hang out with me in the ED, okay? I'll see you guys around.
Hey guys, so for this entire month, I'm going to be in the emergency room, and that is the goal of this video. We will be documenting the emergency room experience for a week, okay? Today is actually Monday, so I'm starting out my day in the emergency room. Our rotations are usually a month long, so I'll record for about a week of my experiences, how it goes. I'll share that with you guys as we go along, okay? So come ride with me on this ED journey for about a week, guys, okay? So I'm actually in the ED. I'm gonna head on to the other side, to the patient rooms now. I will put the camera off, okay, guys? All right, guys. So it's kind of quiet tonight, okay? And I hope it stays that way. Well, I mean, we do want a little bit of action, right? But we'll see. So I am actually heading to the other side of the emergency room, and let's see what's going on over there. So when you work the EDs at night, you do get hungry, right? So I'm in the doctor's lounge. There is coffee, and then there's some sodas, there's some juices and stuff like that to drink at night, just to keep you going. Normally, so we've already gotten our food. The cafeteria, they close at 7. It's actually 8 p.m. right now. So I just came in here just to find something to drink real quick. Okay, guys, I'm done for the night. Getting ready to head out now. The night wasn't too crazy, I tell you guys that. I did have that case of DKA. I also had another one for stroke, a hemorrhagic stroke. We had another one for, I believe it was pulmonary embolism as well. And there was also other like minor ED stuff that wasn't too crazy. So overall, it hasn't been a crazy night. Like at this hospital, we do get the really like serious cases like gunshot wounds and stuff like that. Because we're a level 2 trauma center. The only thing that keeps us from the level 1 is just that we don't have a burn unit. Again, it wasn't too crazy tonight, but we'll see how it goes tomorrow, because I'll be back here tomorrow. I may be working, no, I'm actually in the clinic tomorrow morning up until 12 noon, and then after that, I'll head back over to the ED. So I'm gonna do night shift in the ED again tomorrow. So exciting stuff, you know, ED is my zone. All right, I'll keep you guys posted. So I'm back home, guys. Yeah, I'm tired. I'm exhausted. Like I said earlier, I didn't stay till the end of the shift because I actually have to be in the clinic at 8 o'clock in the morning. So I had to leave a little early. That way I can go home, refresh, take a shower, at least get a few hours of sleep before I can head out to the clinic in the morning. So we have the option, when you're in ED rotation, you have the option of either working night shifts or working day shifts. So I sort of try to plan out my schedule that way. I can still be able to get a decent amount of sleep before the next morning to head out to the clinic. I actually don't have clinic every day, so for this rotation, my clinic days are Tuesdays and Thursdays. I'll go ahead and take a shower, get some sleep, and we'll do this again tomorrow, guys. All right. What's up, you guys? It's another day. I am in the clinic today, so I'm done with my clinic patient. But I do have a lecture to present today to my team. So for us in that program, every time you're done with an inpatient rotation, you do have to present a lecture on that, or they give you a topic as well. So I'm on the schedule for today, so I'll work on that. And after that, the rest of the day will be spent in the emergency room. So keep y'all posted. Well, I am in the library. I actually did my lecture presentation here. I'm done with that now. I'm gonna go ahead and grab some lunch and then give myself a few hours of rest, and then around 6 o'clock I'll be heading to the emergency room to get the night shift started. So guys, I will see you in the ED later. So guys, it's 6 o'clock in the evening and I'm back for another ED shift. Another day. I'm in the emergency room, guys. I actually just got here like 30 minutes ago, and they were already called for a level 1 trauma. There is a gunshot wound of a gentleman. He's actually being brought in by the helicopter, and that's what we're waiting for. So the trauma team, everyone's sort of on standby right now to attend to him as soon as the helicopter lands and he gets to us. So I'll keep you guys posted. Of course, I can't have the camera in there, but I'll keep you all updated.
So just real quick, an update for you guys. That patient that I talked to you about at the level 1 trauma. So apparently this was a patient that actually shot himself in the head, and there was more like some expulsion of brain matter as well. This patient was actually transferred to a smaller facility to be stabilized, and so he was flown to our emergency room for high acuity of care. But as soon as he made it to the helipad and then got brought down to the ED, he honestly just passed away. So it was basically a futile effort there. He was gone. So we didn't have to do too much on the patient. So they had already started the resuscitation at the other facility, and he was actually flown here for a higher level of care. But as soon as he arrived here, about a few minutes just being here, he passed away. So it's an unfortunate situation. I mean, that's what we keep talking about with mental health. I mean, this gentleman shot himself, and these are the things that bear repetition, bear discussion, you know. And this still goes back to the whole issue of mental health. It's a big deal in our world these days, you know. This man shot himself, and someone had to bring him here out of concern, you know, for his life and everything, but unfortunately didn't make it. So, but anyway, I'll keep you guys posted. All right, guys, I'm heading back now to go back in the ED and go find more patients, more trouble to get into. All right, guys, so I'm all done. I'm getting ready to go home now. So we did have a few other cases, not as severe as the first one that we had when I first started the shift. Some cases of heart failure, some cardiac arrest, and also some lacerations. I had to suture the patients. Nothing too crazy. The rest of the cases weren't as crazy as the ones from earlier. So that's it for now. I will be back tomorrow to continue this, guys, because I'm working nights again in the emergency room, so we will continue. Alright, guys, it's another night in the ED. I'm back in the ED to continue this week of my emergency medicine rotation. I did work in the clinic this morning, and then I had lecture in the afternoon, and I also went home, had a few hours nap, and it's actually 6 p.m. now, so I am back here. It's supposed to be a 12-hour shift overnight from 6 p.m. to 6 a.m., but I may not stay the entire shift just because, as usual, I do have other things scheduled in the morning, so I'll probably not be here the entire 12 hours, but we'll see how it goes. So fingers crossed for an awesome night, a quiet night, a beautiful night. We'll see. You never know what to expect in the ED, right? All right, guys. Still in the emergency room, guys. It's a busy night, but not crazy, so it's going well so far. We've actually had several cases today. Nothing too crazy, nothing out of the ordinary. Just your good old bread and butter emergency room cases, you know, sickle cell, crisis, chest pain, cardiac arrest, strokes, and things like that. But overall, it's going well so far. What's up, y'all? So the shift is over. I am heading on home now. Spending this week in the emergency room just got me thinking, do you really want to do fellowship right after, or just go straight to work? But we'll see. 2 years is still a long time from now, so we'll see how that goes, right? And something interesting happened today, guys. So I actually did get a phone call from a recruiter for an emergency room, and she had emailed me and also sent me a text and was like, oh yeah, I want us to talk about the possibility of you working in an emergency room. We're more like a smaller hospital, so they were wanting to get more like my thoughts on that to see if I had interest in it. So I was like, well, I'm keeping my options open, but I know for sure as far as the setting where I want to work after all this, it's, for me, my preferred setting is emergency medicine and outpatient, like in the clinic. So guys, we've come to the end of my week in the emergency room. I do hope you guys enjoyed hanging out with me. I personally enjoyed every moment of it. I sort of showed you my typical schedule this rotation in the emergency room. So the mornings I was in the clinic, and then during the afternoons, so on Tuesdays and Thursdays, I normally had lectures, or some days I presented, and some days I participated in the lecture and had where other residents presented. But anyway, overall, it's been an exciting experience. An important thing here is that the emergency room is definitely not for everyone. Not a lot of people like to be in that setting. I know there are people that enjoy like inpatient, like hospitalist kind of setting. I happen to be one of those that it's actually not my preference. My ideal setting is, clinic, and then also the emergency medicine, like a combination of that. And that's most likely what I'm going to look for by the time I'm done with residency. But then again, we'll see where life takes us, right? So this weekend I'll be at the main hospital for inpatient service, and then next week I do have my vacation, so I will actually continue my ED rotation when I return from vacation, my 1 week vacation. So that's it for now, guys. I appreciate you guys for subscribing. I appreciate y'all for growing with me on this channel. Thank you so much. Thank you so much, guys. Please take a second and hit that subscribe button. Also hit that like button, notification button, every hittable button that you need to hit. Just go ahead and hit it, guys. Thank you. I appreciate y'all. Until next time, y'all, everybody take care, and I will see you again later.